Well, welcome, Dr. Manning. Dr. Manning is a board-certified clinical neuropsychologist. She earned her PhD from the University of Texas. She is the director of the Memory Disorders Clinic, the director of the Neurobehavioral Assessment Laboratory, and the Harrison Distinguished Teacher Professor of Neurology, and vice chair for faculty development in the departments of neurology at the University of Virginia. She has additional appointments in the departments of psychology, neuroscience, and School of Nursing. In addition to being the director of the Memory Disorders Clinic, Dr. Manning is an active member of the Parkinson's disease and Huntington's disease treatment teams at the University of Virginia. Dr. Manning is also the past chair of the Central and Western Virginia Alzheimer's Association and was appointed by the governor of Virginia to the Commonwealth of Virginia's Alzheimer's Disease and Related Disorders Commission. Her clinical interests include models for provision of care for dementia, caregiving and diagnostic issues in dementia, and cognitive and behavioral changes associated with neurodegenerative diseases, including Alzheimer's disease, Parkinson's disease. She has received the Partnership Excellence Award from the Huntington's Society of America, the University of Virginia School of Medicine Award for Clinical Excellence, was a fellow in leadership and academic medicine at the University of Virginia, and is a member in the Academy of Distinguished Educators. She received the 2019 Sharon Holster Women in Medicine Leadership Award. She has current and previous funding from the Administration for Community Living, the National Institutes of Health, the Alzheimer's Association, the Virginia Department of Aging, and the Alzheimer's and Related Disorders Fund. Her publications and research involve the effects of neurodegenerative disease on caregiving, memory, apathy, and decision-making processes, and the impact of vascular risk factors on dementia in minority populations. So thank you, Dr. Manning, for participating in this webinar on professional development and leadership in neuropsychology. We welcome you, the entire ANTS community, and thank you for taking the time today to participate in this.
It's my pleasure to be here.
So today we are bringing together questions from the ANTS community that have been drawn from students and trainees at all levels of training. And we were hoping to ask you some questions pertaining to professional development, specifically in neuropsychology, and to really get your insight into these various domains. So the first question that a trainee asked is, how are the governing boards and or committees structured in non-psychology specific organizations? And how may this differ from psychology specific organizations such as APA?
Okay, so governing boards and committees is structured in non-psychology. In some ways, they're very similar. Typically, the boards that I am on or have been on have a chair and a vice chair and often a secretary, and then another group of committee members. And so that's not so different from what you see in APA or psychology groups. But what you do tend to see, depending on where the boards are, is people coming from a lot more varied professions and more kind of different walks of life. So if I'm on a community board, or say the Alzheimer's board, I am often the only neuropsychologist, but there will be community members or people who are in other health professions. And so some of the boards I'm on have been more volunteer boards like that. And actually those boards, Alzheimer's board, I think you have to be asked to be on that board to begin with, but often with boards like that, it's expressing interest. It's not like there are a ton of people who are willing to give their time and their energy. So in general, expressing interest in a board is a good way to get on a board. The state Alzheimer's Commission is different. That was, I had to be asked by the governor, and that was by making a place for myself. Part of that was because I'm director of the Memory Disorders Clinic here. In part, it's because of my visibility in terms of my job, but also because I volunteered for things like the Alzheimer's Association. In terms of variability in the way boards function, one of the things that that can be different, can make a big difference in how the board functions is how hierarchical the organization is. So, for example, the board I'm in the School of Medicine. I'm in several boards, if you will, or leadership positions here. School of Medicine tends to be much more hierarchical than, say, the Alzheimer's board, or even I'm in leadership positions at the University of Virginia at large, outside of the School of Medicine. The School of Medicine tends to be more hierarchical than, say, the faculty senate of the entire university. So that may vary based on setting. And the more hierarchical board is, the more the leader of the board is the one who directs things, and you have to make sure you're going through the chain of command as you are working within the board. One thing I would say, and I'm probably going out of order of questions, but is in terms of getting on a board, it's really important to express interest. I recommend that when you are on a board, any meeting you're in, the first meeting you're in and every meeting thereafter, it is really important to make sure that you say something very early on in the meeting. The longer you wait, the harder it is to break in. And once you start talking in a meeting, you're more likely to continue, and people are going to hear you. I will say there are gender differences in that. There are studies that show that men are much more likely to jump in early on than women are. And so I strongly recommend, every voice is important, and I strongly recommend that everyone, in particular women, make sure that you say something early on.
Thank you so much for that.
Thank you for that. Yes, that was really helpful. I didn't know that there was that many differences between the types of organizations. So our second question is related to kind of roles available to trainees. So what leadership and advocacy roles are available to trainees and professionals in neuropsychology, in psychology-specific organizations? And this is a multi-part question. So I'll start out there. What sort of roles are available to trainees?
Okay, so the question is psychology-specific or non-psychology-specific organizations?
So for this one, we'll start out with just psychology-specific organizations.
So
yeah.
I have to say, I'm in a School of Medicine. And my career has been very multidisciplinary. I have been on many more non-psychology specific positions, so I have more experience with that. And my answer to that is psychologists can add benefit to every kind of organization, every kind of board. And I think we are valued for it. And so I strongly recommend that people think it's important to be involved in psychology-related organizations, but that we can have significant impact if we step outside of our psychology world and make sure that our voices are heard on other kinds of boards. So my answer to that is everything, every kind of board. And that in terms of trainees, certainly because Anthony is, you all are well aware of things that psychology trainees can do, but I think in terms of the kinds of organizations that I play a role in, and I don't think you need to think of yourself as a trainee only. I think you have expertise and you can volunteer for those, you know, depending on what your area is, the Epilepsy Foundation or your region, start with your local epilepsy, or for me, it's Alzheimer's or dementia, just go ahead and volunteer. If you want to go in as a trainee, then you can let them know that you want a trainee experience and you go in more as an intern. But it doesn't have to be that way. You can just be, I mean, for example, on many boards, there are lay people and community people, so you don't have to have a fancy degree to participate. So, and then in terms of, for example, the schools of medicine, or if you're in a graduate psychology program in a School of Arts and Sciences, there typically are either graduate student or trainee organizations, equivalent of faculty senate kind of thing, but graduate senate kind of thing. In schools of medicine, there are trainee organizations, there are residency organizations, and I strongly suggest that trainees step outside of what is just neuropsychology. So for example, we have at the University of Virginia, we have a diversity committee both within the department and within the School of Medicine at large. And we have trainees at all levels who participate in those, and we really value what they can add to those committees. So I would say, one, don't think that because you're a trainee, you have to go in as a trainee. You can go in just as you can volunteer for a board or a committee just because of your interest or because of any expertise that you might have. You don't have to have the degree, but also in any organization that you're in, particularly an academic institution, there typically are governing groups that are for trainees. Get outside of the world of just neuropsychology. There's a whole wide world out there, and we have a lot of expertise that we can bring to those other organizations.
Sorry. And related to the roles that you've had both within psychology and neuropsychology and non-psychology organizations, what sorts of positions have you had, and what particularly drew you to those positions, and how they kind of fit in with your interests?
So in my clinical work, I feel that multidisciplinary work is really important, and I feel like that's true in life in general. And so my interest has always been in organizations, both within my community, that is the community being either the School of Medicine or the city of Charlottesville or the state of Virginia, where I can interact. I like interacting with people with lots of different viewpoints and lots of different training. And I feel that as a neuropsychologist, I have a lot to offer, as do all of you. And I think because of our interest in training and brain behavior relationships, we can also often point out things and help guide groups using psychological principles that I think can be really helpful for group direction and group functioning. So in terms of roles, the roles that I've held, I'm on the state Alzheimer's Commission. I was the chair of the Regional Alzheimer's Association Board within the School of Medicine. I'm the chair of the Committee on Women, and I'm the co-chair of the School of Medicine Faculty Senate. And that's so those are roles that I've had or currently hold. And I do think that psychological training is really helpful in terms of, as I said, guiding groups, helping everyone in the group be heard, and helping come to consensus.
Thank you for that.
Another question that trainees have had is, do you need to serve on a committee to gain leadership experience?
So the answer to that is typically yes. So typically you are not brought into a board as the chair or the vice chair. Typically you have to join a board and kind of prove your value, if you will, or have some impact so that people see that you have leadership qualities. But just as it's easier to get on a board than you think it is, because if you're volunteering your time, there are a lot of people who are not willing to do that. And once you're on a board, if you're one of the people who participates, so there's some things I think that help you become a leader on a board. One is showing up. It is amazing how many people get on boards and then don't actually show up. Participating, and as I said earlier, making yourself heard, just being an active member, and volunteering to do things for the board, and actually doing the things that you say you're going to do. And once that happens, it really doesn't take long before people identify that you would be a person who has leadership potential.
Thank you for that.
I have a question actually as a follow-up to that.
Yeah.
For students or trainees who haven't necessarily been on a board but want to have get leadership experience and market their leadership skills, what are some ways that you would recommend that trainees can get and market that leadership without being on a committee, particularly early on in their training?
So without being on a committee, you mean just develop leadership skills? Mm-hmm. So I think being on committees or boards is the best way to develop those skills. But even as you, in whatever job you end up in, you can practice leadership within a job by deciding that you see you take a job and you see that there's a need that's unmet, and so decide that you're going to do that and work with people, talk to your chair and say, this is something I want to do. Or even when you're in training, talk to your mentor and say, I noticed that this isn't happening, and here's a way that could happen, and see if you can create a way to make something happen. And the other thing that's really important in terms of leadership is being inclusive. It's really hard. I think often people think in terms of leadership that the thing to do is to stand out and do everything on your own. That's not really it's not a good leadership skill, and it's not a sustainable leadership skill. It's important to bring other people in with you and to share the work, because if you don't share the work, you're going to burn out, and you can do a better job if you ask people to help you and you work together. So I think some of leadership is not just being the person who is out front, who is appearing to do everything, but I think a way you get elected into leadership positions is to work with people, and within that group of people, show that you are able to work with them together, and then people are more likely to see you as someone who they would want to lead them, rather than someone who does everything on their own and is not inclusive.
And related to that, for people that ask, is leadership just for people who want careers in administration or administrative roles? What would you say to the trainee that says, what if I just want to be a clinician or a researcher?
That's kind of tough because no, you don't just have to want to be an administrative role. I actually really like administrative stuff. And I know, so for example, my husband is a researcher and he thinks I'm insane because why would I choose to do the things that I do? And the fact of the matter is at some point it gets hard to do it all. So if really what you want to do is just be a clinician or just be a researcher, you might want to be a leader in your particular area of research, but it is going to take time away from actually being in the lab and doing your research, or if you're a clinician actually seeing patients. If you are good at saying no, then you can be a clinician or a researcher who takes on a limited amount to do and doesn't let that mushroom. A lot of people do not like administrative stuff, and so if you do like administrative stuff, you will find that very quickly you have a lot more of it to do because people who don't like to do it are happy to give you that. So I think if you are a clinician or a researcher and you want to be involved in some kind of stuff, you have to be good at saying no. You have to choose what kind of board you want to be on or where you can add value, and be good at saying no to everything else. That's true for everybody. And I think for junior people, learning to say yes to the things that are important to you and no to things that that you don't really care about or that aren't important is a really good skill. And that's one of those things where I'm better at talking about it than I am about doing it. So, sometimes it's important to say yes, even if you don't feel like doing it because there's nobody else to do it. But sometimes, if you are really focused on, for example, your research career, you have to say no because being on too many boards or being a leader in things other than your particular research is going to be detrimental to your career. So you really have to decide what's important to you career-wise, make decisions accordingly, and then figure out how you can best contribute.
Thank you so much for that.
Thank you. Some trainees have worry about kind of their own characteristics and how that might fit in sort of leadership positions. So what would you say to a trainee that says, I'm not a natural born leader, can leadership still be for me?
Absolutely. I don't know what natural, I guess natural, there are some people who naturally are the talkative ones who get out there in front. That doesn't always make the best leader. And I think that as people gain confidence in their own abilities and confidence in their training, that people can become more comfortable and better leaders. And sometimes it's the people who maybe aren't natural leaders who do a really good job at including other people and can actually become really good leaders. And so back to my saying, when you are in a meeting, you should say something right away. People who are maybe more natural leaders or more naturally extroverted, that may be easy for them, but people for whom that isn't as easy, you can develop more comfort and more skills at being able to be comfortable with being a bigger presence and shaping things. I did want to, we have not talked about the impact of COVID and on boards and leadership, and I do want to say a word on that. Things have changed a lot in recent months, and we're all spending a ton of time on Zoom. What I have noticed is, one, we all get Zoom fatigue and we're sitting a lot of the day, but also that I have had recently board meetings by Zoom that it used to be that I'd have to drive an hour to get to, or I'd have to take a plane and fly somewhere to get there. I have a meeting this weekend that I can't even remember, it was supposed to be in Las Vegas or somewhere. And of course it's now by Zoom. And so instead of being 2.5 days long, it's going to be 4 hours. And I was recently at, we had a state Alzheimer's Commission meeting, and usually that I have to drive an hour and a half to get there, and it is usually most of the day and then drive back. And so the meeting itself, it's a quarterly meeting, takes all day. Well, because of COVID, we had it by Zoom, and we had the entire meeting in an hour and a half, and I did not have to drive. And the honest truth is we got absolutely every bit as much accomplished as we would have normally. I think there are some downsides to that, in that seeing people in person and social interaction is really important in terms of relationship building for organizations. But I think we've also learned that it is possible to be much more efficient in meetings and to get as much done in a much shorter amount of time. So it'll be interesting to see what happens. Hopefully there's an after COVID, and in the after COVID, what are we going to do? How much is going to be on Zoom and how much is going to be in person? And my hope is that we will come up with some kind of hybrid, that we can be more efficient and maybe not have to meet in person as much as we do, as much as we did pre-COVID, but that still there will be some in-person interaction. And that's just like when I see patients now, I can do, seeing them by Zoom can work pretty well for some things, but I miss other things because, for example, I don't see the whole body. I just see usually from their neck up. And that's true for when you're in a meeting with someone as well. You can't read their entire body language. You're basically just seeing their faces.
Are there any particular resources that you think would be essential for trainees to acquire now, or to look into to help best prepare them for a leadership position?
Yes. So think about what, as a trainee, should think about what actually interests them, and move towards that. I think so. Knowing what you like and what you want is important, and then some of it is just trying things out. See what you enjoy, and typically what we enjoy we're usually better at than things that we don't enjoy. So don't think about what you're interested in, try things out, and don't rule things out because you think you're not a natural born leader, or because you know, the first board you volunteer for doesn't have an opening, and so they don't, that's not a board that you get on. Now, be persistent.
Thank you so much.
And on a final note, what is one thing that you wish someone would have told you about leadership, and how do you think that this will be addressed in the future, or what do you do to overcome this?
So I wish that I had more mentorship and more sponsorship to help me see where there was room for me in terms of developing leadership. And one thing I didn't say in terms of when you're asking, are there things you can do to prepare yourself? And that involves, one of the things that I wish I'd had more of was, I did not have someone saying to me, here, come on, try this, or here's a board you can be on. And I also didn't know that I should ask people about that. So one thing you can do is ask people, what could I do? Or could you help me get on this board? Or could you mention my name? I think that's really important, and I did not have enough of that. So some of that is being in an environment where that will happen, and some of that is asking people to help you with that, to make sure that that happens. Look for both mentors and sponsors. So mentor providing you advice and a sponsor actually putting your name forward for things. I think that's really important. And my interest and my impact really has been more outside of neuropsychology than within neuropsychology, and I really enjoy that. I had no idea that's where I was going to end up or what I was going to do, but for those of you who end up in schools of medicine, I think we as neuropsychologists can have a huge impact on the direction not only of our departments, but of the school and the university in general. And so do not underestimate what you can do, or that as a neuropsychologist, that what you have to do needs to stay within the neuropsychology realm.
Well, Dr. Manning, thank you so much for taking time out of your day today to join us for this webinar series on professional development and leadership in neuropsychology. Thank you so much for sharing your experiences and what you have learned throughout the trajectory of your career with ANTS trainees. We will certainly take it to heart and use all of that to kind of propel our careers in taking leadership and advocacy roles within neuropsychology, and as you alluded to, even more broadly, really making sure that we make a mark on other fields outside of neuropsychology.
Wonderful. It's been my pleasure, and good luck to all of you, and I'm sure you're going to do great things.